Hi, I'm Matt Ross, and on behalf of the COVID Theater think tank, I want to thank everyone for joining us today. We started this group to work together across disciplines and in dialogue with public health experts to address the challenges facing our field. With this event, we're looking to gain a shared understanding of where we are, where we're headed, and what it means for our field from some of the leading public health experts in our country. We hope this town hall, which is the first in a series, will be informative as we approach a major reopening of theater. I want to thank our partners, Situation Interactive, Reelman Productions, Broadway Briefing, The Apollo, Harlem 2020, the Industry Standard Group, and New York Women in Film and Television for their support. And now to introduce our panelists, I want to welcome our moderator, the theater critic for New York Magazine, Helen Shaw.
It is so wonderful to be here to talk about this field that we treasure so much, especially on, at least if you're in New York, a vaguely sunny day. And I want to ask everyone who's watching to put their questions into the YouTube chat. This is a sort of unprecedented opportunity to ask the great minds in epidemiology and public policy some key questions about what we can actually do to make the theater safer. So now is your chance to ask those questions, and I will pass them on as we go forward. So I want to introduce the people who will be joining us. I'm going to start with Dr. Blythe Adamson. Dr. Adamson is an infectious disease epidemiologist as well as an economist, and so focuses on the interplay between making both health better and also making that function inside our economy. She is the director of quantitative sciences at Flatiron Health, as well as being an affiliate professor at the University of Washington in the Comparative Health Outcomes Policy and Economics Institute. Also, a fascinating recent article on what we can learn from sports, which will perhaps come up later in our conversation. Thank you. Our second guest is Dr. Bruce Y. Lee, who has long been an advisor to the CTT group. He is professor of health policy and management at the City University of New York, where he is the executive director of the Public Health Computational and Operations Research, which he founded about, 13 years ago, 14 years ago. Thank you so much for being here, Dr. Lee. We also have Andy Slavitt, who is, of course, a familiar face for many of us, senior advisor of the White House COVID-19 response team, and always the most optimistic and joyful of the voices on those public briefings. And so a welcome face here as well. Mr. Slavitt, thank you so much for being with us. And Dr. Teresa Y. Smith, Associate Dean of Graduate Medical Education at SUNY Downstate, also author of a powerful op-ed in the New York Daily News about vaccination, about being conscious of both community responsibility and community health in the choice to get vaccinated. A very beautiful piece of writing, which I encourage you all to read. Okay, thank you so much for being here, all of you. And I wanted to start with a little bit, a kind of a portrait of where we are now. Obviously, things have been changing enormously just in, it seems like every minute that goes by, the situation changes. So I was wondering if I could ask you each to give a snapshot of what you think our current situation is, what you think the where we are in terms specifically of vaccine rollout and goals, and where you see as what you see as our current greatest challenge in keeping those goals moving forward and keeping us moving out of this crisis. So if it's all right, we might start with Mr. Slavitt. Would you tell us where are we with vaccine goals and how you are feeling about our current situation?
Well, great to be with you all. Thank you for having me. This should be a fun conversation and fun to be with Dr. Smith and Dr. Lee, who I have not had a chance to meet yet, but Blythe Adamson, you can just summarize that bio you heard as total badass. I think you're going to have a great set of people to hear from today. Where are we in terms of the vaccine rollout? Well, today we hit 100 million Americans who've had their first shot of the vaccine, which is both a very consequential place to be, and I think with gratitude towards people in every city, in every town, in every pharmacy, in every hospital, in every lab, and every logistics operation in the country. This is an enormous undertaking, and it couldn't happen without incredible teamwork. And I'm just very proud of everybody who's been involved in this situation. It's also a reminder that we have 330 million people in this country. And so, it's really interesting. One of the things that I find is like people who are not yet vaccinated, they want to know about, they want to talk about our variants, and they want to talk about disease, they want to talk about the spread. And then once they get vaccinated, they want to know, what can I do? Forget that other stuff. I want to know, like, can I go do the show? Can I go do this? Can I go do that? And it's just amazing kind of where you sit. It is a very freeing experience to be vaccinated. And I think watching people go and visit their grandparents and parents in nursing homes or across the country or wherever for the first time, it's just a reminder of all the things that we had lost, but all the things we can now value again in ways that maybe we didn't value them before. And so without going too much off on that soapbox, I would say we are making progress today. We vaccinated 3.4 million people, and there's no reason that we will see a let up in that, but for two things on the horizon. One is when we run into people that are still very, very hard to reach, people who are homebound, people who are migrants, people who are in communities that make accessibility to the things that we think of as quite easy, not so easy. Now, for most of us, we're going to have within 3 weeks a vaccine appointment available should be available within 5 miles of where 90% of the country lives, and all of the barriers to prioritization are going to also be removed. So you can imagine a place where by the end of May, the vast majority of people who want to get vaccinated are vaccinated. But that leads to the second challenge, and that's about the people who aren't sure if they want to get vaccinated. What about them? What if we can get vaccine access to people? What are we going to do about the people who aren't sure if they're going to get vaccinated? And the best answer, to be totally honest, is just let them do their homework and help them do their homework with real facts, because these vaccines tell an almost unbelievably good story when people know the facts and do the homework. And so our job is to provide very clear, transparent information that people can trust, and that people can making sure that information gets out to people very locally, to people who they trust. And if we do that, that will accelerate vaccination process, and that will, I think, over time, more and more people are deciding to get vaccinated. I'm going to stop there. Obviously, with just one final caveat, which is not only are we not done yet, but we have challenges that remain, and people can see those challenges. And it's very hard to hold both optimism and caution in your head at the same time. I think we all really feel like we want to be optimistic now. We've got there's a really good case to be optimistic. There's also an equally compelling case to stay very cautious and remember that 1,000 plus of our fellow residents in this country are dying every day and haven't had a chance to get vaccinated yet. And if we can hold on and do that, do what we're doing, not quit early, then I think we will be able to get there sooner rather than later.
Thank you, Dr. Smith. One of the confusions that I have, and I think other people have as well, is the difference between universal vaccination and herd immunity. If universal vaccination is not possible, is herd immunity the answer? And at what point do we begin to move around our society as though we are now post-crisis, as opposed to in the heart of the crisis? As someone has written about vaccination, I was wondering, how do you see that moving line between the sort of the moving line of encroaching vaccination and, again, this sort of ever departing line of when the crisis will feel over?
I think it's really important to understand how the vaccine is going to help you to be able to answer that question. And, one of the confusions that many people have is that, is the vaccine a cure? It's actually not a cure, right? And viruses have been around this earth for centuries, beyond centuries before mankind, and they will be here forever. And they're very, very smart. As you can see, COVID has already mutated itself. The point of the vaccine is for you to help your body protect you from when you get exposed to COVID, because we will all still be exposed to COVID. But what you want is to have antibodies that are going to help protect you and to be able to fight it off so that you do not get severe disease. So that's what vaccines are doing for you. Knowing that information, we realize that, yes, you're going to be vaccinated, but you're still going to have to protect yourself because you can still get it. And the research is still not out yet to say whether you would still be a carrier if you're vaccinated, which means that even though many of us have been vaccinated, you still have to wear the mask. You still have to make sure you're doing hand sanitization, right? And washing your hands and keeping the social distance, because we may be carriers and therefore we may be able to pass it on to the unvaccinated. So knowing those two sets of information, what is it going to look like in the next few months to the next year? We're going to have to go slow. And really, it's going to have to be patience so that we will let people into theater, into normal life slowly. We will get individuals vaccinated, but those who are vaccinated will still have to wear masks. And then, we'll eventually slowly get people back into normal life. Slowly. We'll have to do it as a group. But groups of individuals being let into theaters. Right now, we're at 50% capacity. It'll eventually get to a greater capacity. But I think really what we need everybody to realize is that it's going to be patience that we're going to need. And as far as herd immunity is concerned, herd immunity is when we have enough people vaccinated that if you do get even mild illness, right, you will mostly all be protected so that it will not cause severe lethal disease. We have a while to go to that, right? We still need to get our children vaccinated before we can even talk about herd immunity.
Okay, thank you. So just yesterday or 2 days ago, there was a very hopeful news item about the possibility of at-home testing. The technological advances, obviously, that give us the current vaccines are astonishing by any measure. That they seem more flexible, more powerful than medical mitigations of this type have been in the past. And I was wondering if Dr. Lee, you would be comfortable talking a little bit about what have you seen in the sort of the meeting of this crisis, which has either surprised or delighted you, that has been sort of more effective than we thought we would be able to be, say, a year ago at this time?
Well, yeah, thanks. So we're definitely at a much better place we are now than we were like several months ago, or certainly last year. So I think we have several things going on our side. So one is the fact that more and more people are getting vaccinated, as Mr. Slavitt mentioned. So that's good. We also have observed that this virus has some degree of seasonality, meaning that it looks like during the winter months when the virus gets when the weather gets colder and drier, the virus seems to be transmitting more readily. So things are warming up. The temperature, humidity is increasing. So regarding your question, certainly getting the vaccine rollout is key. And as Dr. Smith alluded to, there's a twofold purpose. One is to protect you as an individual, but also it's to protect the population and to find some way of potentially interrupting the transmission of the virus. So what we really need to do is view each of these interventions as layers in a multi-layered approach. So, we've got the vaccine that's being rolled out, but we can't forget about face masks and social distancing while the virus continues to spread fairly readily around around the population. And then testing is something we should keep in mind as well, because testing will help us understand where the virus is actually spreading. Mm-hmm. So the analogy I frequently use is you're running onto a football field. And if we're running onto a football field and we don't know where the opponent is and don't know what the field looks like, then it's hard for us to really play the game. In other words, it's hard for us to quote unquote win the game. And testing provides a key element behind that, because testing really helps us understand where the virus is actually spreading. So the road to safe reopening and the road to recovery is really getting a sense of what's the virus doing in the community. And when I talk about community, I talk about every community, not just like the United States in general, but specifically, because if the virus can find pockets where it can continue to spread, then we continue to be at risk. So we have to know what's going on throughout all the different types of communities. So the fact that we have different technologies being rolled out, like you alluded to in-home testing, regular testing, the vaccines out there, et cetera. So we do have an arsenal of things out there. The key now is how are we going to use this in a coordinated manner? And and I want to throw in face masks and social distancing as well. So we have the pieces of the puzzle there. The key is how do we continue these strategies in a coordinated manner so we have eyes on the field and also make sure we have layers of protection. And the sooner we can do that, the sooner we can, quote unquote, return to normal, because really control the virus is the road to recovery. So if we want to, make sure things are reopened, if we want to have economic recovery, we really have to control the virus. So I think the positive is the fact that, a lot of different individuals out there and groups out there have sprinted to try to make these technologies available. So that's been great. But the key right now, I think, is coordinating these things and having the right amount of patience.
And because you walked right into a segue there by using the metaphor of the football field, I want to turn to Dr. Adamson, who has been so focused on the lessons that we can learn from the way that sports have and have not succeeded at this question of both of coordinating all of these moving parts, audience and player, test and I suppose trace, and obviously now the development of a vaccinated group at the heart of the sports event as well. And I was wondering if you could talk to us a little bit, since I want to pivot us towards the more specific concerns of the theater community. What is it? I know that you're going to go into more detail about this later, but in another talk, but I wanted to get a sense from you. What are the key lessons that you feel we can take from the coordination that has or has not been possible in the world of sports?
Oh, great question. Coordination that's been possible, and also resources, testing resources are what really have enabled a lot of these major sports leagues to be able to reopen safely. One of the big things that we've learned is that frequency of testing is really important. And we also learned this from schools and universities. So looking at universities who have dorms where people are living together in these really small spaces almost has more implications for theater and people who, are backstage, maybe together in these very small, tight environments. And we've learned that, it's possible to have a negative PCR test and just a few days later be at the peak of your most infectious time. So, we can't necessarily free ride on, I got a test that was negative 2 weeks ago, and so I'm going to assume that, I'm good to go. But I think piggybacking on what Andy was mentioning of the concerns of vaccinated people, they want to know next, what am I allowed to do? And I think the theater community has a really legitimate reason to say, what are we allowed to do? How are we allowed to perform now if everyone in, all of the staff and performers are vaccinated? What does that mean for an indoor performance? Under what types of conditions could a performer take off their mask and perform something if they're vaccinated and being tested frequently? And to me, those are some of the most interesting questions that we have left to address when, a theater may not have the resources of the NBA to institute all the protocols that they wish they could. Yet this is where I think we can learn from some of these scrappy school administrators that have been designing safe protocols for schools and classrooms. So I'm hoping that we can bring together all of those lessons to help the theater community develop safe protocols.
That is so interesting. This is actually for all of you then, because I don't know who will know the answer, but I admit that I have assumed that as we move towards full vaccination, if we can get close to full vaccination, that testing will begin to fall out of the toolbox, that it will not be as intense a part of our public health strategy. And it sounds like from what you're saying that you don't see it that way at all. And I'm wondering, at what point are there actual metrics past which the population moves, at which point we say we no longer test, at which point we say, okay, coming into a theater, you don't need to, for instance, show a negative test, or a person filming on a film shoot in Williamsburg doesn't need to walk on set with a negative test. How do we tie those practices to actual developing numbers? And again, for anyone who knows the answer to that, please have at it.
Well, one of the keys is we have to remember that testing provides information for surveillance in general, to have an understanding of where the virus is actually spreading and to what degree. So if you look at other countries that have managed to reopen, over the past year, or quote unquote reopen, Australia, New Zealand, South Korea, Taiwan, the key thing is they have a good idea of where the virus is spreading. And they've managed to contain the virus to the point where, if you see an outbreak somewhere, they can rapidly contain it because the numbers are a lot lower than we've had here. So the key is to really get the level of activity, the virus activity, the spread of the virus, and how many people are actively infected low enough so that we know from a general population risk that the chances of getting infected are a lot lower. And so testing really provides that line of sight. Ideally, we need to have like a map of the United States that shows, here's where the cases are increasing, here's where they're decreasing. Right now, we have very, very like broad-based numbers, like overall numbers for the entire country, and maybe we have numbers broken down to some degree for different regions, different states, and municipalities. But we don't really know where are the most active pockets, and currently the numbers are still relatively high. So what we want is the overall numbers to get lower, and to have a good line of sight to know that, if we have a hotspot somewhere, we can quickly try to contain that hotspot. And when we can get to that point, then it's a lot safer to then start interacting, because we know where the virus is going, and we know everyone's relative risk level. So that's why testing is so important. We have to continue testing, and it can't just be testing, again, of people who can afford tests or people who have real access to tests. It has to be to everyone, because as long as the virus is spreading really actively somewhere, it can always jump to different communities.
Go ahead, Andy.
Oh,
Go ahead, Andy. I'll follow up after.
Let put it this way: there's two reasons why it's important to test. That one of them is that this spreads asymptomatically. So if this was like the flu, and everybody who had it knew they had it because they felt really crummy, they wouldn't need to take a test. They'd just stay home. They wouldn't send their kid to school. They wouldn't go to work that day. They'd say, so that's one thing. The second is that unlike the flu, in bad cases, it can kill you, or it could do severe prolonged damage. So you don't really want to get it. So imagine though now a world where we have some sort of therapy, like a Theraflu, and that if you got it, you just take a pill, and it wouldn't be that bad. Maybe you'd be out for a couple of days, but you wouldn't have a severe case. You wouldn't have a very high viral load. In that case, the stakes of getting COVID-19 would be way, way, way down. So there'd be less reason to feel like you needed to test. Now, what Dr. Lee's talking about is that we're always going to, at some level, want to be able to monitor where the disease is. We can do that lots of ways. We can do that by monitoring toilet water, believe it or not, right? Sewage water will tell you. You could look at a whole dormitory or a public housing building or a prison or a factory and say, oh, looks like there's some COVID. We need to start taking some of the next steps and maybe start to reduce things. So as we get back to a normal situation, different innovations at different points in time are going to make it less necessary. But if I were a high-risk person, or if I had a high-risk person in my family, and the consequences of them getting COVID were high, and I wanted to be cautious, I probably would choose to do things like wear masks maybe when others weren't, or to test and make sure I was only going into places where other people had tested, unless there was, again, a very reliable therapy. So we're just going to have to watch for those kinds of things. They will happen gradually. I try to remind people there's not going to be one flip the switch moment in society. There will be a moving of the dial step by step. And in those movements of the dial, I think those are the kinds of things that will move it further. Sorry, Blythe, you probably were going to say something 10 times smarter than that.
No, I really love how, Bruce, you talked about the value of testing from, this surveillance perspective, where the information we're getting from those test results is actionable by public health officials and, designing policies to keep our population safe. And then Andy, you countered with this, but as an individual decision maker, if I can do something about giving myself better outcomes. And, I think I just wanted to bring it to life a little bit more by saying, if I were to imagine myself walking into a theater, and I'm going to sit in the front row of this audience, I'm so excited to see a show finally. And, in my fantasy, like at least half the people in the audience are vaccinated. Maybe they don't need to get tested. But then there's half the other people, they haven't had access yet to test. But I know that as a requirement, everyone here has had either a negative PCR test result in the last couple of days, or they showed up unprepared and they paid more and got a rapid test result right away, so that I'm confident that people around me are negative or vaccinated. We're all wearing masks, but there has to be a different testing protocol for the person on stage in front of me. If there are going to be performers on a stage and I want to feel comfortable with them removing a mask to sing, or musicians that must remove a mask to perform, then the expectations that I have of those performers and the frequent testing they get to help me feel comfortable, as an audience member, masked up, with my KN95 mask. I think that's the situation we still have to figure out, like as a community, when we need to make decisions for when a space is safe for an indoor live event. There's a lot more to discuss.
And I'm so glad that you're talking so specifically about spaces, because theater is essentially like a network of venues and spaces. And one question I know that we all have is there a way, there is making the human body healthy and tested, and there is making the space healthy and tested. And I'm wondering, what kind of mitigation do we see from ventilation? So is it that we cut infection rates in half, by a third, by a tenth? What happens when we introduce fresh air, when we introduce swiftly moving air into a room? And is it possible, because what frightens me, practically speaking, when it comes to sort of the actual practical economics of it, until a test is as cheap as a condom, and when you walk into your doctor's office, there is a fishbowl full of free PCR tests, I don't see how we're going to have that kind of diffusion of testing that we will really need. What are the interventions that we can make in buildings to make them produce those healthy outcomes? And what kind of numbers have emerged over the last year about how effective those interventions are?
I would love to just throw in, I'm so glad you asked this question, because my fear is that we're going to waste a lot of time and resources doing, Hygiene Theater, that's not actually going to reduce the risk of transmission. So if we reopen theaters just with temperature checks and using Lysol wipes on armrests, I'm going to be really disappointed, because the return on investment of those same resources could be put into, taking MERV 8 filters in the ventilation and, bumping them up to MERV 15, or identifying spaces backstage that just have no ventilation at all and putting in some portable HEPA filters. And I think investments in that type of infrastructure will pay off in the long run, even after COVID, of making sure that we have healthy air in all of these community spaces.
Yeah, although Hygiene Theater is one of the best theaters I know. That's a terrible joke. The thing that I think you'll find is that I would predict that this will become a minimum standard for all indoor spaces. I don't even think this. If I were going to guess, I don't think it'll be a choice. I think there will be healthy building designations. There already are beginning, and you can simulate, in effect, being indoors with the right type of filtration and the right type of ventilation. And there's experts on this, and they're going to all be worth billions of dollars. Like the next Bill Gates is like this wonky guy who decided to study building ventilation 20 years ago, and no one ever heard of him. And now they're going to be Time Person of the Year because indeed and look. To Blythe's point, it's way more important than 6 feet of distancing. Way more important. Way more important than hand washing, and all those things. Those things are great. You should always do that. I teach my boys you should wash your hands every time you go to the bathroom. But still, it's not. The big issues are you get someone into a crowded room where people are singing and clapping and yelling, and it's enclosed and the air's not circulating. That's exactly the danger, and that's how you don't leave with one case; you leave with dozens and dozens of cases, and those dozens and dozens of cases, just how the math worked, each of those infects people, and you've got a real problem, and then you really are have to close or what have you, whatever happens next. So I think this is going to have to happen no matter what. I do think testing will become cheaper. I do think, there will be, just sort of common things at first, like how you space the seats and so forth. And I think, my guess is that the very, very high risk people may be uncomfortable going in person to shows unless there's maybe a Sunday show that's only for people who are vaccinated or something like that. So it's just, I think you're going to step into it with this multi-layered approach, and any one thing, even a vaccine, isn't the answer until the vast majority of people are vaccinated. I think doing multiple things is probably going to be part of the answer.
I think that's really important. I just wanted to add to what Andy is saying, that essentially, to summarize what we're all saying, it's going to be a stepwise approach, right? Mm-hmm. We're not going to automatically, all of a sudden, it's going to be, 2019, and we're all walking around maskless, not testing, and, vaccination is not really that much of a concern. It's going to be a stepwise approach, so that, we started off with the vaccine, having masks and protecting ourselves with hand washing before we had no vaccine. Now we're adding the vaccine. And now as we start to get back to some sort of sense of normalcy, we're going to have to, again, be patient and take it in a stepwise approach. And, as Andy said, it's probably going to be better for our buildings, for our system, and even just for us, right? We're actually washing our hands much more now. And we've been saying all of this in medicine for years now. How do you stop spreading infectious diseases? Wash your hands. Now everyone knows how essential that really is.
Mm.
One of the key findings last year was the contribution of aerosol spread for this COVID-19 coronavirus. That's one key distinction between this virus versus the flu virus, that there's a greater component of aerosol spread. And so that basically means that, rather than just sort of immediate droplets that might just come out and fall, within 6 feet, you have these smaller droplets with viruses that may hover for a while in the air. And so that's why face masks are particularly important, but also why ventilation has become an even bigger issue. And as Blythe mentioned, there are other problems with poorly ventilated areas. And this is actually a public health issue that has been a concern within the public health community for a while, with indoor pollution, indoor air pollution, et cetera. So this pandemic has helped expose a lot of existing problems. And so if we address this problem, we're actually going to solve other problems in the meantime as well.
It makes me. Oh yeah, sorry. Go ahead.
Oh no, I was just going to say, like you can frame it as an issue or frame it as an opportunity, because we have a lot of closed buildings that this could be a perfect time to go in and make improvements to ventilation.
We may have to saw the tops off a lot of skyscrapers. But yes. So this is a question from our chat audience. Do the panelists expect and or recommend that theaters mandate vaccination for cast, crew, and or patrons? And I think the key there is mandate. How heavy should the hand be on the scale?
Well, as an economist, I would say we should incentivize people to be vaccinated. Mandate's a pretty harsh word, but I think that rewarding and encouraging people for showing up vaccinated, it supports a broader community effort that we're trying to do together.
So $10 for vaccinated patrons, $15 for all you grubby remainder. The reverse of child pricing at last. Is there ever going to be a point at which, my MMR vaccinations when I was a child obviously got me into school. Is there going to be a point at which we, from a public health perspective, say, no, this is something that we must do as a culture. It is no longer optional. And I suppose that really is a question for Mr. Slavitt.
So it's thankfully not a question for me, because I actually don't speak for myself at this point in time. I speak for the U.S. government, and so I'm not at a place where it makes sense for me to offer my own opinion. I think there are a lot of strong opinions on this topic, and there are also a lot of strong valid opinions on this topic in all directions. There are some people that view this as an important thing for them to be able to do to demonstrate their vaccination status. There are some businesses that view it as a way to demonstrate safety and as a way to open more safely. To the contrary, there are a lot of Americans who feel like this is an overreach, and that it is not the role of government to be coerced, for anybody to coerce them into having a vaccine. And in fact, some of the people on the fence today about taking vaccines, this plays into some of the narrative of people who are anti-vaccine. And so I think we have to respect the fact that there are a lot of issues at work: personal liberties, equity. Not everybody has the ability to get a vaccine or to demonstrate it. So it's one where I don't think you're going to see the federal government play a strong role. I think what will be up to you all is to take a theater owner to decide, boy, I had a show that didn't require vaccination status and it was only 10% filled. And then I had one that required it and it was 100% filled, or vice versa. And so I think you'll make your own decisions with your people who set your policies and with your lawyers and with people who are thinking about these issues. And I think I expect it to evolve that way. Sorry, I couldn't be more forthcoming with an opinion, but that's just the situation I'm in.
I think it's important to, right now, while there are no strict policies, to educate the masses, including the theater goers, including those who are the staff of the theater, make people feel comfortable with getting vaccinated. The jury's still out whether we're going to have to get booster vaccinations or not. And we really want this to be, where everyone feels comfortable, everyone feels confident. And I think that is really where we should be going towards, as Blythe said, making it an incentive, but then also educating people so that they understand what the vaccine is doing for them and why they should get it. So that when they do make that decision, it's a comfort decision.
This is actually a decision or an issue that has been going on for quite a few years within the healthcare community and healthcare facilities. So with the flu vaccine, for instance, there are different healthcare facilities that may require to different levels that staff and healthcare workers get vaccinated. And in some cases, they'll say, okay, you can't work here if you aren't vaccinated. But you can see there's a fair amount of heterogeneity in what different healthcare facilities will actually require. So for some examples, you might want to look at, what hospitals and different healthcare systems are doing.
Now, we used the term earlier, Hygiene Theater, which, for those who haven't heard it, it's the appearance of an ameliorating, or it's the appearance of a mitigation, which does not, in fact, have a whole lot of impact. I personally think of taking off my shoes at the airport when it comes to that. But that one of the things that has certainly been prevalent when people think about getting back into rooms, into theaters, they talk about things like temperature checks and deep cleaning. And these are, I know that I went to an event recently and had my temperature checked, and the person said very cheerfully, "You're fine, your temperature is 94.8. And I thought, I'm dead and cooling. That's not a human temperature that I would like to be. So there is a kind of, in New York, we have these deep cleaning passes through the subway, for instance, which may or may not have real impact. These are also very expensive interventions. And so I'm wondering, at what point is there, as Dr. Smith said, this is so much about communication, about making people comfortable with what does work and also aware of what doesn't. So for the four of you, what are the things that you would like to see stop? What are the things that you think, okay, Helen, stop wiping your groceries, which I will, I am still wiping down my groceries just out of I love the smell of rubbing alcohol in the morning. So what for the four of you, what are the things that you think are most shallow in that we've learned do not work? Dr. Lee, I know you have one.
Well, the temperature and symptom checks is a tricky thing, because it can catch people who actually have active fever and symptoms, etc., but it can miss a lot of people. So it can give you a false sense of security. Asking people if they have symptoms is a quick thing that you can do, but the question is, would someone who actually shows up to the theater say, "Oh yeah, that's right, I have symptoms, I shouldn't be here," and turn around. So that's one thing that's I think frequently done more for quote hygiene theater. The question is how expensive is that? If it gets expensive to set up tables to do that and to check temperatures, etc., that's not really high yield. So that's one thing I would say. And then some of these advertised, there's all these things out there, like these aerosol bombs where they say, I remember a picture where people were running through this gateway where they were showering down like a mist. I think some of the sports teams were using that, and that's just going to cover you with moisture. But something like that, especially if it's expensive, is not going to be very helpful. So those type of things where it looks great, to have this mist come out and people run through it, but I don't think it's actually very that helpful at all.
It does feel like Phantom of the Opera will be able to use that, whether it's a good COVID minimization technique or not. It could be really powerful entrance for the Phantom. Okay, so because Dr. Smith talked about step-by-step processes, the audience has gone wild with questions about specific steps. And so one question is, what are the protocols for how actors, singers, etc. can be on stage unmasked? What are the protocols that have to be met that in your minds are most key? And also, and this is difficult because obviously every theater is different, but do you have any sense of what kind of timeline we are on before we can have unmasked performers on a stage with some level of confidence?
I would say the other category that we should probably throw into this too is, when is food and beverage okay? We've seen studies from Germany that have showed us that intermission can be one of the riskiest times in a live entertainment show. We've seen success with, we can bring people in a orderly way that keeps them separated. We can have them exit the theater, but intermissions when everyone's, mixing up all together, and now they're taking off masks and, eating and drinking alcohol in a very small space together. So I think that we're probably going to have similar thinking about, when it's okay to do those things as when we think about, not having a mask on stage. I mean, I think we start with vaccination and then go among for a vaccinated person to take off their mask and clearly, expose someone. What's the way that we can have the greatest confidence that that person is truly negative? And so that's where I think that the testing protocols for performers who must remove their mask will be different than all of the other members of the theater staff there who are able to do their jobs while staying masked. But I think it's not certain. I think there's not agreement yet. So I would love to hear from the others on the panel what their thoughts are, what we'll need to get there.
Well, I think the summer is, all the months leading up to the summer and the fall is going to be really key. It's a really important time, this period of time, because the question is, number one, what percentage of the population can we get vaccinated before the fall and the winter, when the weather starts turning, quote unquote, against us? Right now, the weather is getting warmer and air is getting more humid, et cetera, and that may decrease transmission and people are moving outside, et cetera. So the question is, what can we do leading up to the fall and winter? Can we get enough people covered? Can we start getting better control of this virus? And if we can, that bodes better for the fall and winter. If we can't, then the concern is there's still enough widespread viral activity that we can have another surge next fall or next winter. Or this coming fall, this coming winter. So really, I think what we do in the months leading up to the fall and winter is really important. Can we get as many people covered as possible? Go ahead, Amy.
Let me try to make it simpler if I can. Put the audience aside. Okay, let's assume that we spend some time addressing that. Let's assume that they're protected from the people on the stage in whatever way, distance, plexiglass. They're decided to take their own risk, have done testing, whatever it is. Put that aside. Then I think the question you're asking about is, at the time of the performance, are the people on the stage COVID positive or COVID negative? And I'll go, this is where Blythe, I think, and the work that she's done with the NBA and others is valid, is if you know that the players on the court are negative, they can go play their game. So what you're talking about here is just, I think, frequent testing of cast members. That is an investment. I don't want to dance around it. That's an investment that probably is going to need to be made for each other's sake, not the audience. But if you could imagine, if you close your eyes and imagine that you knew for certainty that everybody who's coming on stage was COVID negative, number one, and number two, you knew the audience was protected or that was not the specific concern, then I think you're in a really good shape. If you're in a situation like the NBA got into, where it's like, boy, so-and-so cast member goes out and parties and doesn't take a test, then the cast members are going to be nervous. Then you're talking about the kinds of things Bruce is talking about, which is, are you in a place where there's a lot of COVID spreading, et cetera? But because you can't control for those things at all times, you're going to have to require, look, if you're getting on the stage, then every day at 4 p.m., we're going to take a saliva test, or you're going to take an instant test, and then I think you can feel quite confident, and the cast can rely on one another. And I think there is a certain amount of, it sounds like a soft thing, but there's a trust framework here. There's a certain amount of like, you know what, these other 12 people in the show with me, they're all people I know, I trust, I work with them, they're like family. I wouldn't unnecessarily expose them. So when I tell them I got a test at 4 p.m., they can believe me. And that's just, it's a cultural ethic. Once you do that, everything becomes much easier. It's really when you have like 20 strangers that come together, right? That's when it gets more complicated. But if you have people that are in the same show together over and over, night after night, and nobody wants to put the show at risk, because why, that's not in anybody's interest, I think you're going to be in good shape there. I don't think that it'll be more complicated than that.
Is there an analogy with film production? Those are, again, small groups. They're people who test constantly. Now, they have more resources, and theater is notoriously resource poor. But given that, how has that been working?
Helen, I was just going to...
I'm sorry to apologize that I'm going to have to jump off of this.
He has a hard out at 3.
Oh, thanks, Andy.
I wish I didn't have to leave because you guys are so great. And I'm looking forward to going to literally all of your theaters as soon as possible. So thank you for all you do.
In the next couple of minutes. Okay. Thank
you.
Helen,
I'm so glad you asked that question because it was exactly the comment that I wanted to make after, hearing that last, film and TV sets right now that have budgets of $400,000 per week to spend on testing. Obviously, that's not going to work with live theater. And, one of the questions that we're seeing from one of the audience, from someone live streaming this right now is, how can we make this affordable? And I think that there are actually lots of different ways to, creative solutions to, try to do this in a cost-effective way. One of them is pooling. So it's this concept of, instead of testing every single person individually, you gather together a group of swabs and you run one test. So imagine, just to oversimplify, instead of paying $100 for one test, you're paying $100 for 10 tests to be run all together. And if you get a positive, someone in that pool is positive. An example of this being brought to life right now is in Massachusetts. The schools are now using pooled testing. And when a pool becomes positive, they'll follow up with the quick rapid test. To then rapid test everyone, with all the students within that pool, to identify, okay, who exactly in this small group is positive. And I think that's just one way that you can increase the frequency of testing those key players unmasked on stage without necessarily breaking your budget.
And just to be super clear, if I have let's say I have a 10-person show, 5 people on stage, 5 people backstage, and all of those people are vaccinated, my confidence is extremely high that even if they do get COVID, which is totally possible, we see that happen. It's not so startling considering the millions of people that are going to need to be vaccinated. Of course, those results will sometimes happen, but my confidence would be very high that they will not get seriously ill and will not go to the hospital. Is it a wrong equation to say that if those 10 people are vaccinated, then we can do this batch testing once a week? Is that a wrong equation as opposed to 3 times a week? Is that wrong to say that vaccination buys you more leeway when it comes to the other interventions?
I'll let one of my colleagues answer this one. But I've been talking so much. I want to give Dr. Smith and Lee an opportunity.
I'm worried that hypothetical is too hypothetical, but is a fully vaccinated cast and crew, don't they have liberties that a non-vaccinated cast and crew would not have?
I do think so. I don't know if we can go as far as to say as infrequently as once a week for someone who's going to be in a role that takes off their mask, but perhaps a stage manager who's been vaccinated. They're behind the scenes and they're around everyone else, but they get to keep their KN95 on the whole time they're doing their the whole night. They could have less frequent testing than someone who is vaccinated, but will be, if they were infected and unaware at that peak viral load, even though we know that they themselves might not be hospitalized because of their vaccination status, we still, I would say one of the greatest uncertainties that we have as scientists right now is the likelihood of being infectious to other people once you're vaccinated. and infected currently. We don't know, does being vaccinated make your duration of infectiousness shorter? Does it make your viral load lower? So maybe really the potency of virus that's on your breath, is it, less concentrated? We're still trying to figure those things out. And so I would say that your question we'll have more confidence in answering it as time goes on, and we have more time to study the transmissions that happen from vaccinated people.
And again,
I'd say the short answer.
Sorry, go ahead.
The short answer to your question is yes, but it's not like a direct correlation. But the key thing to remember is, as the risk of the virus spreading decreases, then so does the need to test, because the idea of testing is really kind of getting a picture of what's going on. And so all these things work together. And so, yes, if you have nothing but testing, that's like having nothing but underwear on or something like that. Then everything is relying on that, right? That's one line of defense. And that defense has weakness. So, but if you're layering on different things, then you have more redundancy and you have more protection. So yes, you can arrange things strategically so that it's not as intense or not as overbearing to do a given thing. So the short answer is yes. It's not exactly like a one-to-one correlation saying that, if everyone's vaccinated, then you can reduce this frequency by this amount. But if more and more things are layered on top of each other, then you can do things a little more selectively.
And I think it's really important in just combining both of those points is, one, you're not just thinking about the individuals in the room, right? Because until we have the science, as Blythe said, to know if we're carriers, what if that cameraman goes home to, someone who chose not to get vaccinated, right? And so then that's what the question is. And so until we can figure out the science to figure out, are we still carriers? Until we can reduce, as Bruce was saying, the amount of transmittability that we have with the virus, then, we can start to be a little bit lenient on testing. And then maybe eventually further on down the road, you won't have to get tested at all. But as I said before, it has to be steps. And, we have to be very conservative in the beginning. And then we can relax a little by little as the science is starting to build up our sense of confidence, as more people are starting to get vaccinated. But in the beginning, it would behoove the theater industry to be as conservative as possible so that we can at least open and then relax your rules, right? So start a little bit stricter and then loosen up as the time and the science and, the vaccinations become much more ubiquitous within our society.
So all of you think so carefully about the intersection of public health and public messaging. And this question of, you put it so well, if we move conservatively, if we move slowly, if we move step by step, if we think carefully about these layers of protection, we can open and then peel away those layers of protection as they become redundant. That one of the things that I know grips the theater community, and I'm sure it does every community, but I'm a monomaniac and only care about the theater, is that we don't know what those steps are. And so every single theater kind of feels like they're making it up. They're like, well, we should do 6 out of 10 of these things on that list. That's what we can afford. No one's telling us we can't. And so I wonder if there is anything on the horizon which feels like public, I don't want to say diktats, they're not like, as you said, mandate can be a scary word for people and it can drive people away. But where do we find these steps? Where do we find this list of best practices? And how do we tie it to the metrics of infection in our own community?
Well, one of the roles that I've been really excited to see emerge over the last year in theater, film, TV is the role of this COVID compliance officer. And there are people who maybe were not medical or public health before, but have adapted from a behind the scenes role to take on the responsibility of helping the group follow the protocols, enforcing mask wearing, monitoring quarantine and isolation timelines. Yet one of the struggles that I hear from that perspective is exactly what you said, Helen. There's not an authority right now with giving a specific enough instructions for this type of theater productions. And so I would love to see a counterpart resource developed within local public health departments, or at a level where this COVID compliance officer, or even the groups writing protocols that are specific to a theater space for when you have traveling casts come through your space, that they would have either a national level resource or a liaison within their local health department to be able to run their protocols by, to give us that authority, so that they don't waste their time sanitizing things that really aren't going to prevent any infections at all.
I think it's going to be really important for the theaters to partner with their state and local governments, because it's also going to be important to track the COVID positive rate, right? So what happens in one state might be a little bit different in the protocols in the next state, depending on what the COVID positive rate is. And so I think, as Blythe was saying, it's going to be really important to have an open communication with your, whoever is going to be the authority within your theater company, and then, talking with, say, in New York City, the New York Department of Health, and then from the state level to the national level. And I think that we do need a little bit more coordination with that, just seeing that as a healthcare worker working in the emergency department, that, we got better control of the situation when we were able to communicate, with our city and state government officials, and to really try to build our protocols based off of that. But even within the hospitals, the protocols are different.
So the algorithm, I would say, really depends on, a cascade of things. So we've seen in other countries, you have a warning level, right, in a given place, which basically gives you a sense of the spread of the virus in the community. So that's number one. So what you do will be different depending on what's happening in the community. If there's many cases and the virus is spreading quite widely, then that's one set of situations. On the other extreme is, you have more minimal community transmission. And then so from those things, then you can have an algorithm of how you handle things. So if it's spreading fairly widely, then the concern is that anyone who comes in can potentially be the source of another outbreak, right? So that the risks are higher. So in that kind of situation, you really want to maintain, very strict social distancing, because it just takes one person to come in and to spread the virus, and assuming that not everyone's protected against the virus. That's a very different situation from the opposite end of the spectrum, where you don't have that much transmission going on, and then you have a lot more leeway in terms of what you can do. So there's actually a cascade of decision points that you can make. So first, see what's happening in the community, then see what's happening with your staff, and say, okay, is this a group of folks who have been together, have been quarantining together, or have created a social bubble, et cetera. Then like with the NBA, then there's lower risk in terms of continuing interactions. But then you say, okay, that's one group, and then you've got the other group, which is people coming in as audience, et cetera. And for those folks, you still need to maintain social distancing. So there's a whole cascade of different types of decisions that you can make depending on the situation. And I think it's really important to get the information to figure out what the situation is. And then when you know what your situation is, then progress through that algorithm to say, okay, this is what we can do then. And so there are tailored ways of approaching it. And so it really depends on first quote unquote situational awareness, and then progressing down that algorithm.
So it sounds like if I can reduce this to the sort of the most basic level, is you're saying if you are a theater managing director or whatever, you are running a theater, make contact with your county health supervisor, because the two of you will need to be in coordination so that you even know those numbers, so that you know what community spread is like, so that you can take the accurate sort of, and then I would assume that that connection is going to, again, only lead to good things if there's communication between county health and the theater. So we are in our, is that fair to say? I just barreled through that and was like, have a liaison.
Yeah, but I would also say that the theater company should also work together, right? So that a certain region is making the same decisions, right? And so that will really fare out well with the public, so that they know, it's not that just like theater company A is doing this and B is this and C is that, right? But that everybody's working together. We found at the hospital, having these frequent groups of communication so that no one's working in silo really did help us move forward. So, while there's that, the vertical communication, there should also be horizontal communication with the theater companies communicating with each other.
And then I think the last element, if we're talking about public health officials and resources, the theater company, then I'd say unions are probably another essential group to be included in the conversation, so that when they're coming up with, standards of keeping these workers safe, that they're based on reasonable things that are actually going to keep them safe, and not just showiness of, we're going to have hand sanitizer everywhere, and so, don't worry, everything will be okay. So we want to make sure that all of those groups are talking together.
I'm part of a consortium that was organized by the Aspen Institute called Project Play. It's now Project Play 2024, and it includes all of the major sports leagues like the NBA, Major League Baseball, National Hockey League, etc. And what this group has done, even at the very beginning of the pandemic, was put together guidelines for, not just for all the major sports, but for all like the leagues and the youth leagues and local sports teams, et cetera, to follow. And so I think a combination of being in contact with what's happening in your local area, and then having like a major group, major theater groups come together and say, okay, and working with different experts and saying, okay, this is the cascade of things or decisions that need to be made. These are the algorithms, and then this is how you can do things at different levels. So if you go to the website, it includes things like, okay, what's your situation right now? This is what's safe to do. This is what's more dangerous to do. So people can kind of work through their individual situations to really come up with the right solution.
Right, making the decision trees public. Yeah.
And I think theaters are so different from each other, just like many schools are different from each other. And so the right policies for a theater that can seat 50 is going to be really different than one that can seat 1,500, and recognizing the different attributes of those spaces.
So we need to move into a little overtime, actually, of moving us into the Q&A section. We've had a few questions coming through from people as we've gone, but here are a few questions from the people watching. The first one is, many smaller theaters are shifting and expanding their outdoor programming. What are your thoughts on safety protocols when it comes to crew and cast, and audience, when it comes to an outside production as opposed to an inside production? Do you think of them as deeply qualitatively different, or simply different in terms of scale?
I'm so glad that someone asked this, because I'm dying to see more outdoor theater. We need to be encouraging and affirming outdoor activities as one of the safest things that we can be doing together and interacting together. There have been studies that show that the transmission risk is 28 times higher indoors than outdoors. And, I know, but on the other hand, not all productions can be done outside, but the ones who can, or even the rehearsals that can be done outside, we really should be doing it as much as possible. Every time I walk through Central Park, I'm just like, why am I not seeing a lot of people who are dying to be out there performing, giving us a chance to experience that.
Yeah, outdoors is it's like a gigantic ventilation fan, larger than any fan you could possibly put indoors. So it significantly reduces the risk of aerosol transmission. So you still have to maintain the other precautions, but because you can still have direct transmission and those things like that. But it greatly reduces the overall aerosol transmission, which I think is a key component.
Another question, is it safe for shows and companies to start planning for a return to theater going in the fall with testing in place and increased ventilation? When does the panel think plans can actually start to be made? Are we at that point?
I think they should start now. Planning is always important. Whether your go live date may, push back than what you can target for. But I think one of the issues that we had with last spring is that we didn't have a plan, right? We were not prepared. So plan now. Even if you don't have a go live date, what is that structure of the algorithm that we were talking about? What is that going to look like? As you can see, there's so many layers that I think there is a lot to think about and to talk about. And, theater companies should start together, getting all their stakeholders sitting at a table and saying, okay, this is our committee, this is our plan, because it's going to take a lot of discussion. So, while again, your go live date of when the theater may open is unknown, it's a big question mark. Planning should be done absolutely now.
Yeah. And go ahead, Bruce.
Go ahead, Blythe. Go ahead.
I was just going to say, I know that the math works out differently for different types of theaters. So if it's a commercial Broadway theater and it only makes economic sense to open with 90% capacity allowed or higher, they may have to wait a little longer. We may see off-Broadway productions that are receiving government subsidies that can financially operate at a 50% capacity, that they may be able to open sooner than ones where just, the math doesn't add up until they can really fill all of the seats.
One of the key things to keep in mind is, one of the key things to keep in mind is one of the misperceptions or misconceptions last year was that, there's shutdowns and it's either shut down or not shut down, right? And we have to keep in mind that shutdowns are a timeout when you have, you don't know what to do and you need to catch a breath and catch up. Actually, if you look at, so I've been in the pandemic preparedness community for about 15 years or so. And back in 2010, after we were working with HHS in 2009, one of the questions came up and said, okay, if we had to institute social distancing and school closures and those things like that, we emphasized that those will be very difficult to maintain. So we actually, a decade ago, were running simulations to see what would happen if you put in alternative variations of school closures or work closures or those things like that. How can you maintain operations, or how can you do things to compensate for the fact that there's certain things that you can't do? And so the pandemic community has been thinking about this for a decade. And what people don't realize is that what should have happened in 2020 was there should have been a plan in place before that to say, okay, if we have to do this, if we have to close schools, if we have to close businesses, how do we create alternative situations where certain things can continue? Or how do we create new paradigms where you can still have theater, but it's safer theater, not hygiene theater, but safer theater. And so I think it's important to keep thinking that way, because there's this binary thinking that either things are closed or they're not. But there are many alternatives. There are many ways of doing things in a safe manner. And we've seen that in other countries where they've been able to do it. So I think as a result, planning as quickly as possible, as soon as possible, may raise some very interesting ideas. You might find that, okay, even if activity hasn't gone down as much as we thought in the fall, we've come up with these alternative ways of staging the show or broadcasting show or what have you. So I think we should get away from that binary thinking.
I'm curious because all of you are thinking about messaging, about incentivizing, and is there in your own work, have there been things that work well when it comes to encouraging community buy-in? I think that was a question in our yes, it was a question from our chat. Would love to know if the panelists have suggestions for encouraging community buy-in to safety protocols. Things that you have found work that overcome reluctance, that overcome fear. I know that we tend to make our decisions based on how safe we feel as opposed to the actual knowledge that we have. I know I booked a show the day after I got my vaccine appointment, not after I got vaccinated, but I got my vaccine appointment. I was like, I feel great. I'm going to go and sit in a show wearing 7 masks, whereas I had been too frightened the day before to make that decision. Clearly making a decision totally based on feelings instead of facts. And so what have you seen as good ways to help people make good decisions, communicate these practices to people as a way to kind of adhere a community together?
Ongoing dialogue like this, right? I mean, how informative has this been? I mean, I'm sure for those who are viewing the live stream, but even for myself, right? And so I think the ongoing dialogue, because things are ever changing, and continuing that and making sure that you continue to have town halls, making sure that you create these pathways of open communication with your, community partners in theater and even your theater groups within themselves. And so having that discussion, having that communication, allowing people to vent their concerns and, figuring out what needs to be fixed, right? Like, understanding for the Department of Health, where we needed to get the vaccine and how there still continues to be health inequities within being able to get access to the vaccine. What about our elders who are immobile? How do we get it to them? And the only way for us to know that is getting that feedback. And so it's really important to continue the dialogue. And so the more people are able to communicate, the more that they are able to get their questions answered, and they feel a lot more confident and comfortable.
So just to sort of show people the backstage a little bit, Dr. Adamson just said, I have some resources I can mention that I've added to my website for theater folks, and I would like this, we're very close to the end of our event, and I would love for all 3 of you to talk about places you would like watchers to go for more information. So starting with you, Dr. Adamson.
Oh, well, I knew that this is a limited amount of time. I wanted to make a few key points, but there's just so many resources that I would love to share with the community. So I already today posted just on blytheadamson.com a link with some of the specific COVID prevention resources that I thought would be most helpful for the theater community. One of them is a great 80-page document from Rockefeller Foundation that we designed for how to create a testing program for K-12 schools. I think has a lot that would be useful, and resources from Harvard for how to check the air exchange in your space to even figure out, is ventilation something that our group should look into investing in. So I hope that those are helpful, and you can find a contact page for me there if you want to follow up with more questions.
Thank you.
I would encourage for those who are in the New York City area, which I know houses a lot of the theater companies, the New York City Department of Health Vaccine Finder. And to, if you just even Google it, but it's it basically is Vaccine Finder, NewYorkCity.gov. If you go there, you can keep abreast to where you can find the vaccine. The supply of vaccine is ever changing. Like this week, there is a lower supply, but next week, I believe there is more supply coming in. So you really have to keep track and continue to keep checking on the Vaccine Finder to be able to figure out where locally you'll be able to get the vaccine.
Thank you. Dr. Lee?
So I cover health and healthcare for Forbes. So I'm writing, I've been written quite regularly on COVID-19 since the whole pandemic started. Actually, my first COVID-19 article was January 3rd, 2020, when I realized that something was going on with that mysterious pneumonia. And so, so my website, brucewiley.com, or you can also Google Bruce Wiley Forbes. We've created different types of resources. So one of our models was adapted by New York Times to show, when we might reach different herd immunity thresholds. So you can check out that interactive tool in the New York Times. We continue to do modeling work, and publish. So there are research papers on our different findings. I mentioned the Project Play has a website. So if you just do Project Play 2020 or 2024 COVID-19, you'll find a COVID-19 resource page there that is contributed to by all the major sports leagues, et cetera, working with different experts. So those are some of the resources. But I mentioned a lot of the resources also in my articles as well.
Thank you. So for those watching, this has been an opportunity to sort of look a little bit back and a little bit forward, but there are future editions of this think tank, and they will be drilling further down into specifics. I believe the next one is on, again, what we have learned from the world of sports, their successes and failures, and how reopening has functioned for them. And in future talks, we'll also be prioritizing. We've been watching the chat and seeing that people are particularly interested in union protocols, HVAC systems, testing. These are all things that we'll be able to get into more specifics on a future town hall. So please watch your email. If you've registered for this, you'll be contacted, or checking out the website. I just want to thank the three of you, and of course also thank Andy Slavitt in absentia. We'll just send it up. But thank you so much. Thank you not just for speaking with us, but for the immense amount of energy and care that you have poured into this community and to the communities that surround you. It has been enormously powerful and healing just to speak with you. And so thank you all.
Thank you for having us.